The article that I found about health in the news is titled Calls to Crisis and Suicide Prevention Hotline Surge Post-Election. So this article was just very disheartening, but it wasn't like a surprise to me about what the content was about. The thought that many people would be distraught and perhaps would experience unpleasant thoughts crossed my mind when the election was coming to an end. The article discusses how it has not seen such a spike in calls and texts to crisis and suicide prevention hotlines since events such as 9/11, which I'm going to show you a picture of. Because 9/11, since the death of Robin Williams due to what was found out to be suicide, there was a PSA announcement done on the TV show Glee, and they received a lot of spikes in calls and texts after that was announced on that show, and then also after the Pulse shooting that happened this past summer in Orlando. And so this article discusses how they've never seen such a spike in regard to politics. And also, I believe that this election received a bunch of results, like higher results than what they've seen with those other events that I mentioned. Some takeaways in the article included knowing the signs of depression. So according to the National Suicide Prevention Lifeline, the signs of depression include the following: talking about wanting to die, feelings of hopelessness, increased alcohol or drug abuse, and significant changes in daily habits. For many, the recent American election has left many people feeling hopeless as they feel as if they are a target group for the president-elect. I think that the most surprising of the article for me was that the fact that some helplines are still receiving an influx of calls, because I know that oftentimes it's just like immediately after an event happens, they'll receive like an increase in stats reporting on how many calls and texts they received. But even like days later, they're still receiving an influx. And an issue that I'll talk about later as well is that they don't have enough people to actually respond back to these people, and that's very concerning. They were saying that some of those include the crisis text line and the Trevor Project. So those are some of the lines that are receiving the influx of calls. According to the Trevor Project, lesbian, gay, and bisexual youth are 4 times more likely to attempt suicide than their straight peers. All of this is very sad and scary that our country is in a crisis right now across many groups of people. The article mentions how the young people who are calling in do not know who to turn to, and when I read that, I thought back to the beginning of this semester when we discussed the different dimensions of health. Personally, when I'm going through tough times, I rely on my spiritual health to help me cope. Spiritual health, as we mentioned, doesn't have to mean believing in a higher power or a God, but it is more so knowing that knowing your worth and purpose. And as mentioned in our book on page 64, the National Cancer Institute, or the NCI, declares that when we get sick, spiritual well-being may help restore health and improve quality of life by decreasing anxiety, depression, anger, discomfort, and feelings of isolation. Our book on page 9 informed us that sexual orientation factors into health disparities. It is stated on that same page that gay, lesbian, bisexual, or transgender individuals may lack social support, may be denied health benefits due to unrecognized marital status, and may experience unusually high stress levels and stigmatization by other groups. And it was, even though the article didn't use specific words such as feelings of isolation and things like that, like that's very clear as to what they're experiencing now, because they feel like they're going to be isolated because of the president-elect during his campaign had made comments and declared that certain things that he would do would affect their group of like their community. And so now that he actually was elected to be our next president, now like the situation's heightened and that's why these lines are receiving an influx of calls and texts, because they essentially like feel they don't know what to do. They feel helpless because the person in charge of the country is saying that they're going to be against them. Many members of the LGBTQ plus community are frightened now because our president-elect has announced, like I said, the plans during his campaign that would affect them. And as the article stated, many are experiencing these high stress levels for reasons such as fears of a repeal of the Affordable Care Act, as mentioned in the article, because it would mean to no insurance and no trans-affirming health care. So those who are transgender or in the process of going through that, they will no longer have funds to support their surgeries or even just support in general. And then so our country is in desperate need of help, and the lines need more trained officials, as I mentioned earlier, who can help those in need. And I understand like how they feel and how it is to be a part of a group that you feel is now like directly targeted. And it's just a sad situation, and it's just crazy to think that even with politics, health is involved. So I found this article very interesting, and I think it's something that everyone should be aware of what's happening.